If your lower back has been making mornings feel like a negotiation, this video might completely change the way you think about what's actually going on, because here's something that surprises a lot of people over 50. Back is often not the problem, it's just the place that ends up paying the price, and once you understand why that happens, the path forward starts to look a whole lot clearer today. You're going to learn 4 gentle movements you can do right on the floor that may help restore comfortable mobility, ease the stiffness that builds up during the day, and make everyday things, getting up from a chair, reaching into the car, walking after dinner, feel a little more natural again. And stay with me through the 3rd movement, because that's the one most people unknowingly rush through or skip entirely, even though it may be the most important one for helping your lower back feel less tight throughout the day. Here's something worth thinking about. Has your back ever felt completely fine while you were relaxing on the couch, and then the moment you stood up, something shifted? That first step felt wooden, a little stiff, like your body needed a moment to remember that it knows how to walk. Or maybe you've noticed it after a long drive. After sitting through a movie, after reading in your favorite chair for an hour, you stand up slowly, take a few careful steps, and then gradually things begin to loosen up. That pattern is actually telling you something important. When stiffness fades within the first few minutes of moving, it's often not a sign that your spine is deteriorating. It's frequently a sign that certain joints and muscles haven't been asked to move through their full range in a while, and after 50, that happens more gradually and more quietly than most people realize. Here's what the research helps us understand: the hips and the lower back don't work independently. They're part of what movement specialists call the lumbar-pelvic system, a connected chain where the hips, pelvis, and lumbar spine are designed to work together and share the load of everyday movement. When your hips rotate freely, extend comfortably, and move the way they're designed to, the lower back can simply do its job without being overloaded. But when hip mobility decreases, which happens gradually with prolonged sitting, reduced activity, and the natural changes that come with aging, the lower back doesn't get the memo that it's supposed to share the work. Instead, it starts absorbing movement it was never meant to handle on its own. Every time you bend to pick something up, turn to back out of a parking space, or simply rise from a seated position, your lower back begins compensating for what the hips aren't contributing, and repeated hundreds of times a day. That compensation starts to feel like tightness, fatigue, and the kind of stiffness that greets you every single morning. A 2024 review published in BMC Musculoskeletal Disorders found that people with low back pain consistently show altered hip range of motion and muscle activation compared to people without pain, and that improving hip mobility produces meaningful reductions in both pain and disability. A clinical trial led by researchers at the University of Delaware found that hip-focused therapy helped older adults reduce their low back pain disability faster than spine-focused approaches. Along the spine isn't always the source. Sometimes it's simply the location where the problem shows up. There's also something happening specifically in the morning that's worth understanding. As we age, the body carries a slightly higher baseline of low-grade inflammation, a process researchers sometimes call inflammaging during sleep. The body naturally suppresses some of that inflammation, but as the morning arrives and that suppression begins to fade, stiffness and discomfort can peak. Add to that the simple fact that hours of stillness during the night reduce circulation to the joints and surrounding tissues, and your body needs those first few minutes of movement, not as a sign of damage, but as a kind of warm-up, a way of reminding the joints and muscles how to work together. Again, that's also why gentle, consistent movement is so much more powerful than people give it credit for. Before we get started, go ahead and drop your name and where you're watching from in the comments below. It's always wonderful to see people tuning in from all across the country and from around the world, with the same goal of moving a little more comfortably every day. Now, 2 things to know before we begin. First, these movements are slow and gentle by design. Smaller, controlled motion is often far more effective than pushing for a big range. Second, if anything causes sharp pain, numbness, or dizziness, stop immediately and speak with a qualified healthcare professional before continuing. Move only within what feels comfortable and controlled for your body. Let's begin movement 1. Prone hip rotation with knees together. Start by lying comfortably on your stomach on a firm bed, a yoga mat, or a carpeted floor. Rest your forehead on your folded hands and let your shoulders, neck, and upper body go completely soft. There's no work happening up top now. Bend both knees to roughly a 90-degree angle so your feet point toward the ceiling. From here, slowly let both feet drift together toward the left, then gently return through the center and let them fall toward the right. The movement should come entirely from your hips. Your chest, shoulders, and forehead stay completely still. Don't worry about how far your feet travel. What matters is that the motion is smooth, relaxed, and coming from the right place. A comfortable, controlled swing is what you're after, not distance. As you repeat this gentle rocking, you may begin to feel the hips loosening up, particularly if they've been holding tension from sitting earlier in the day. Aim for about 30 slow repetitions, breathing naturally the whole time. One thing to watch for: people often start rotating their shoulders or lifting their chest to make the movement feel bigger. Try to resist that. Keeping the upper body quiet is exactly what allows the hips to do the work they're meant to do. Movement 2, prone hip rotation with knees apart. Stay in the same starting position, stomach down, forehead on your hands, upper body relaxed. This time, gently allow your knees to drift apart into a comfortable V shape. Keep your feet roughly in line with or slightly wider than your knees. Now, with the knees apart, slowly lower both lower legs together toward the left, then return to center. And move toward the right. You will immediately notice this feels different from the first movement. That's intentional. By changing the position of the knees, you're encouraging the hips to rotate through a slightly different range, targeting areas that the first movement may not have reached as fully. This variation is particularly helpful for people who spend a lot of time in chairs, because prolonged sitting tends to compress the hips into a narrow, fixed position. Gently moving them in a wider position gives the joints and surrounding tissues a chance to decompress and rehydrate again. Upper body stays still. Movement comes from the hips. About 30 slow, relaxed repetitions. Focus on the quality of each repetition rather than the speed. Smooth and controlled will always outperform fast and sloppy. Movement 3, single leg hip rotation. This is the one most people rush through, and it's the one that may have the greatest impact. Stay on your stomach, forehead resting on your folded hands. This time, bend only one knee to about 90 degrees, leaving the other leg extended and relaxed against the floor. From here, slowly rotate the bent leg inward, letting the inside of your foot gently lower toward the floor. Then bring it back up to the starting position. The motion comes from the hip joint, not the lower back, not the knee. Complete about 30 slow repetitions on this side. Then switch to the other leg. Now here's what's important to pay attention to. You'll almost certainly notice that one side feels tighter or less willing to move than the other. That's completely normal, and it's actually useful information. It tells you where your body has been compensating, which side has been asking the lower back to pick up extra work. Don't try to force both sides to feel the same. The goal isn't symmetry today. It's gradually inviting the tighter side to move more freely over time with consistent practice. Keep your shoulder, chest, and head relaxed. Avoid rolling your pelvis or lifting your hips to chase a bigger range. A small, honest movement, one that comes from the right place, is always more valuable than a large, compensated one. Research on hip internal rotation specifically highlights this. Reduced internal rotation of the hip is consistently associated with nonspecific low back pain, and restoring even modest improvements in that range has been shown to improve functional movement and reduce discomfort during daily activities. Movement for alternating inner foot taps. For the final movement, stay on your stomach in the same position. Bend both knees to about 90 degrees and let them drift out into a comfortable V shape, similar to the second movement. This time, instead of moving both legs together, you're going to alternate. Slowly lower the inside of one foot toward the floor, then lift it back up. Then the other side, back and forth one at a time, like a gentle, alternating rhythm. Think of it as a slow, calm tap, down and up, not forcing the foot to the floor, just inviting it there. This movement pulls together everything. You've been building through the first 3 exercises. It asks the hips to rotate, one at a time, while your core and pelvis stay relatively stable. It's a coordination exercise as much as a mobility exercise. And that coordination is exactly what allows your lower back to stop overworking during everyday movements like walking, turning, and stepping. aimed for about 30 alternating taps on each side, breathing naturally, keeping the upper body completely relaxed. If you feel sharp discomfort at any point, ease back the range and continue within whatever feels pain-free. And as always, stop and consult a healthcare professional if anything feels wrong. For the best results, try working through all 4 movements once a day, particularly in the morning before the day picks up. Or in the evening, after you've been sitting for a while. 30 slow repetitions for each exercise is a solid goal, but if you're just getting started, fewer repetitions done consistently is far better than a large number. Done occasionally, what you're building here isn't flexibility in the traditional sense. You're rebuilding the communication between your hips and your lower back, reminding your body that it doesn't have to brace and compensate every time you move. And that shift, when it happens gradually over days and weeks, tends to show up in small but meaningful ways. Getting out of the car a little more easily, standing up from dinner without that familiar hesitation, taking those first morning steps without feeling like you have to negotiate with your own body first. This video is for educational purposes only, and is not a substitute for personalized medical advice, diagnosis, or treatment. If you experience worsening pain, sharp discomfort, numbness, weakness, or dizziness during these movements, stop immediately and consult a qualified healthcare professional before continuing. Crossing 50 doesn't mean the conversation with your body is over. If anything, it means that conversation needs to become a little more intentional. The back that feels stiff every morning, that protests when you stand up too fast, that tightens after an hour in your favorite chair. It's often not broken. It's often just been waiting for its neighbors to start doing their share of the work again. These 4 gentle movements are a simple way to start that process. If today's video felt helpful, leave a comment below and let us know where you're watching from. We'd also love to hear which of the 4 movements you found most beneficial. That feedback genuinely helps us keep creating content that matters to you. Thank you for being here, and we'll see you in the next video.